All right, again, we're talking with Dr. Robin Motter-Mast, who practices family medicine with GBMC, from Sheppard Pratt, Dr. Catherine Harrison-Restelli. We've got a question from Maria that came in. Maria says there are so many things going on in the world right now. Hurricanes, Charlottesville, DACA, obviously politics overall have separated a lot of families and created a lot of friction. There's no doubt. She says all of these can be really anxiety provoking and stressful for patients and healthcare workers. What strategies can be put in place to keep the focus on work, family, and helping others if we can? And what are strategies to reduce stress from things we may have little control over? It's a long question. It's kind of complicated, but would you like to take it?
Sure, I'll go first this time. You can really only control what you can control. So that's what you have to remember. You can turn on the TV and there are a lot of things all day long that are going to irritate you and then cause you to have some anxiety. So one of the biggest things I tell patients, if they're having those problems, you need to just shut down all of that type of media, whether it's social media, whether it's TV, radio.
Not the radio. No, wait a minute. Country music.
You can leave the country music and then hit mute.
See, country music doesn't cause anxiety. It helps when you have anxiety. So
yeah, so music is great. Music is therapeutic. So I would encourage you, definitely want to keep the music involved, but those type of news events really are very anxiety provoking. So if you're struggling with that, you just really have to go into your quiet space and you have to fill your mind with things that make you happy and things that kind of empower you and make you feel like you can empower other people. So smiling is great. Work on just smiling, taking deep breaths. There are a lot of mindfulness apps and different things that you can use now on your smartphone that are free, and just really thinking about being in your own head and doing things for yourself and for your neighbors and for your children, and going back to I can only control what I can control.
And finding ways to feel like you're connected with others and not isolated, and that you're engaged in meaningful efforts. So yeah, sometimes a problem feels like it's too big and you can't fix everything. But can you donate to your food pantry? Can you go check on your elderly neighbor? Can you go and help at coffee hour at your church or your synagogue, or something that you feel like you're building and strengthening those community bonds that hold us all together? And that can provide you great service to your community, but also for you a sense of having some belonging and some safety where you might have felt isolated before.
Let's talk about anxiety for a second and panic and how that all ties together. Because I think there's two sides to it. There's the side of someone who's never experienced it before and doesn't understand what it's like to go through, probably saying something totally inconsiderate, like I can imagine someone saying like, "Oh, think your way through it," or because there are definitely techniques that you can learn to think your way through it, to take yourself to another place when you're having it. But when you initially have, especially in the first, I would say, couple of years of dealing with anxiety attacks or panic attacks, dealing with it can be really, really challenging. And it can present like it's a serious medical condition. So that's why I'm really fascinated with what GBMC and what Sheppard Pratt are doing, coordinating the efforts of both medical doctors and you're all medical doctors, but bringing in the psycho angle of it. But I guess talk about I guess different people experience panic and anxiety in different ways, don't they?
Absolutely. So anxiety is one of the most common conditions that's seen in the primary care practice. About 21% of Americans will have a significant anxiety disorder, and it's about 15% in any given year. And the problem with anxiety is you think it's all in your head, but a lot of it's in your body, right? So you can have chest pain, you can feel shortness of breath, you can feel sweaty, you can feel nauseous, sometimes people throw up. You might want to feel like you can't hold your urine. Do you guys remember, like if you ever had to give a speech at school and all of a sudden you have to pee even though you just went? So that can feel anxiety too. And sometimes folks even show up in the ER and they feel like, I am dying. I am going to die right now. And it really feels like you're having a heart attack, but you're not. So the good news is that you're not having a heart attack. And the bad news is it feels like your brain has hijacked your body. So there are things that we can do for that. So there are talking therapies, there are medications that can help, and then sometimes just knowing, hey, I've been through this before, and it feels terrible, but it will pass, kind of like labor pains, and that you can breathe or calm yourself down to it, and you may have to hunker down for a little bit, but it will get past, is hugely relieving for folks.
It can be very debilitating. But the thing that I guess it was most unsettling to me when I first started experiencing them was that it was so unanticipated. In other words, like you might think, well, at least I did. I thought that anxiety was nerves, like maybe getting in front of people to speak or, you know, being in an uncomfortable situation. But it was coming to me in totally comfortable situations, especially where I'm, you know, on the patio with my family, or, you know, with my kids going to school in the morning, or, you know, it wasn't anything that you would automatically anticipate would, you know, that start a panic attack, but they come out of nowhere.
For sure, and anxiety is fear looking for a home, but anxiety isn't bad, right? So, you know, when back in the day when we were all cavemen, you know, anxiety kept you alive. Otherwise, you get eaten by a tiger. So, you know, it's sometimes for people, it's a little bit like that radio dial, and it's turned up too high, and you're picking up all this static. And then sometimes your body will just trigger and release this flood of hormones that feels really uncomfortable when there's nothing objectively going around.
Right.
And sometimes it's the way of your subconscious kind of hijacking your consciousness. So if there's times where you're kind of letting down and you're happy and you feel like you're quiet and you don't have your guardrails up, that's really when those things that have been building up within your system have the chance to come forward and really let you know that there has been a lot of stress and things that you're taking in that you really didn't maybe cognitively say, wow, I thought I was anxious, but really all these different things add up. I often use the analogy of a glass of water. So life, we're all born with a certain amount of water in our glass. And everybody's glass can be a little different. And then the environment starts pouring more water into the glass. And eventually, everybody's glass overflows. So at some certain point, your glass is going to overflow. And the best thing you can do is start removing some of these pieces of the environment that are adding more water to your glass. So that will bring your glass back down to a level that you can actually control on your own.
Wow, good advice. We've got a lot of questions that are coming in and we're getting to. Melinda, would you like to throw out a couple of questions?
Sure. Stephanie just posted a question. She read that if you blow in the area between your thumb and your finger, that's calming to the system. Is that true? Is there any evidence?
I personally have never heard that.
I think she might be referring to the idea in acupuncture and Chinese medicine that there are some pressure points. I'm not as familiar with that. I think if it's soothing for you, it doesn't seem dangerous, so I think that would be okay. But if anxiety is or stress is building up and then that's not adequate, or things you're doing at home are not adequate, then go ahead and talk to your primary care doctor about it.
I mean, I know tennis players, they'll do it all the time. You'll see it, you saw it at the US Open, but I think that's really having the grip on the racket.
Breathing, though, there are definitely breathing techniques that I feel like myself, I can calm myself down if I just breathe. There was a song from Faith Hill that, like, that's what that song is about, and it was written by a woman whose father had committed suicide, and she was going through major anxiety attacks, and her doctor said, first thing you need to do is reset your breathing, because that's tied into your basic body function. So maybe there is something like that.
Well, a lot of people hold their breath when they start to get anxious, and then that has a buildup of carbon dioxide.
Right.
And that can impact a lot of different functions within your body.
Right.
So.
All right, another question from Melinda.
Another comment. Go ahead and call me Mindy.
Oh, Mindy, I'm sorry. All right.
Unless I'm in trouble.
Gotcha.
This question is from Judy, and she wants to know if there are, or what are your beliefs regarding using essential oils to help people with anxiety and other problems at times. Is that?
I think there's a lot of people out there that think that essential oils help, and if you feel that that is something that helps you, then you should give it a try. I'm not sure that there's a lot of evidence-based medicine that is out there to support that essential oils really decrease anxiety. Not to say that that means it does not work. It's just there haven't been studies done to confirm that. So if anything makes you feel better and you think that that helps, and usually the oils smell pretty good too, so they're a pleasant aroma to the brain. If you think it helps, then go ahead and do it. It won't hurt anything.
But these are both medical doctors, so you are writing prescriptions, and there are medications that obviously are called for and that work.
Absolutely. The hallmark for treatment of anxiety are a group of medicines called the SSRIs. They work for depression, anxiety, for panic, for PTSD, and they're safe and well tolerated. They're once a day dosing. You start at a little baby dose so that you don't get a little GI upset, and then you ramp up slowly. And if you took 100 folks in a room and they were all having a significant problem with anxiety or depression, about 65 of those folks would respond to the medication. Half completely better, half kind of better but not really, so you got to tweak it. And then that other group, not really a change, but then you just switch to the next medicine and try. So one day, and hopefully soon, we'll be able to take like a little cotton swab and check your genetics and know which of these medicines will work the best for you. But now it's a little bit of a trial by error, so you got to stick with it a little bit, be patient, and while you're doing that, maybe do some psychotherapy, work on your breathing, work on your exercising, and do other healthy things, and we'll get you through the hump.
And if you don't mind, I'd like to kind of transition us to a different topic about how we actually talk to our patients that are coming into our primary care offices about, do they have anxiety or do they have depression? Because this is something that's different. This is really what we're here today to talk about, is this new program for behavioral health integration within your primary care practice. So we had a great idea. I shouldn't say we, but lots of folks around the country have found, using evidence-based guidelines and looking at measures, that people who actually have depression and anxiety have an increased utilization when it comes to healthcare. So you may have diabetes or you may have high blood pressure, and you're really having a hard time getting to goal with those things with your physician. And we found that those people actually have triggers for depression and anxiety, and those may be the reasons that are holding you back from actually getting to your goal that you've set with your primary care physician or your cardiologist, whoever it may be. So we have developed an integrated program where we actually have placed psychiatrists and licensed certified social workers in the primary care practices. We really wanted to remove the stigma that was associated when people think that they have some type of depression or anxiety of getting to that next level of care. So we've brought it into the primary care offices where we really think that people are most comfortable with having these type of discussions, and so far we've been really successful. It started in July, and we have seen over 2,000 patients so far with our certified social workers and our psychiatrists. So the patients, the feedback from it has really been amazing. One example of this would be a patient who came in and maybe thought that they were having issues with ADHD. So sometimes with ADHD you have a hard time concentrating. And what we found is if you actually ask the right questions, maybe it's not really an attention deficit issue, it's actually an anxiety issue. So we've been able to tag these great new team members in our practices and ask the right questions and get to the right diagnosis and then implement the right type of treatment. So it's been really a great experience.
That's awesome. I think the one thing that you hit on that I'd like to repeat is that there is so much stigma about our minds and about getting any kind of psychological treatment. And it's so ironic to me because you can go into a restaurant and people will loudly speak about their bowel movements and about their sexual, whatever, but you won't talk about the brain. Excuse me. And and right away people are feeling less than because they're dealing with it.
Yeah, and many folks, feel most comfortable getting treatment in their primary care office because that's the doc they know the best, and it feels familiar, and they want to bundle it into the care with everything else, and that makes sense because your body is not just like a head that's been locked off. When you're physically not feeling well, it affects your mood and your mind, and then when you have depression or anxiety or addiction, that also affects how you care for your health. So if we can do it in an integrated way, you get better outcomes and for better bang for the buck.
And maybe that will help people to realize that there should not be this embarrassment about the mind is just another organ in the body, the brain, I should say.
Sure.
There's so much, and we're never going to change that in our lifetimes, I guess, but there is such an embarrassment about it, and that's why I feel like open. I think I was amazed at Sheppard Pratt and what the hospital offers and the programs that are going on there. And my eyes were open to it through my cardiologist, who said, yeah, maybe you need to be treated for an anxiety issue. And I ended up, there's an eating disorders clinic, and a Dr. Harry Brandt, who is in that clinic. So I'm still not really clear why or how he is dealing with, anxiety, but I guess it's all part of it.
Sure.
And he was buddies with my cardiologist, so they knew each other. So it's a small world, doctors in Baltimore. So GBMC and Sheppard Pratt are doing a lot together. That's what we're here talking about. Shelley wants to know, what questions do you have to help convince someone to seek help that is not acknowledging their depression? I'm not sure I understand that question. I guess basically, let me rephrase it. How does someone know when they need to seek help?
Sometimes they don't. It sounds like she's speaking from observation from a loved one or someone she cares about, and sees some signs that she is relating in her own mind to having some depression or anxiety. And having that frank conversation with people sometimes works and sometimes doesn't. I go back to, if you have a relationship with your primary care physician, we are trying to ask some probing questions for every patient who comes in. So every patient is being screened for depression. And if they have something that turns out positive with just a couple basic questions, and the questions are, in the last 2 weeks, have you had little interest or pleasure in doing things? Have you felt down, depressed, sad, lonely? So if somebody answers yes to that, it triggers us to ask additional questions. So even if that person themselves doesn't realize that, if they have enough insight to think about how they've been feeling for the last few weeks, that helps us to further go down the road and ask some more.
And you could always accompany your friend or your loved one to their doctor. Encourage to write them note, or say, I notice in you that you're not yourself, and I missed the old you. How can we help you get better? And sometimes that feels less shaming or less worrisome for folks. Now, of course, there are people who get really ill, folks who may develop a psychotic disorder or mania, where they may lose touch with reality and really can't see themselves well. And then folks should know that they can always call 911 or bring their loved one to the emergency room and to get the proper diagnosis.
Carolyn wants to know, she says, lately I've been feeling depressed and I'm not really sure if it's bad enough to see a doctor. How does a person know when they should seek? I mean, there's such a gray area depressed. I don't know, or is there?
Well, that's why we try to use these screening tools, and they actually give us a value.
Okay.
They give us a value of mild, moderate, symptomatic, severe, and we can try to help you then put yourself, gauge where you actually are. But then it really comes down to, how are you interacting with other people in your lives? Are you having any problems at work? Are you having problems with your other relationships? Are you still engaging in social activities that you normally would with your friends or your family? Those are some of the things to help you gauge, really, do you really need treatment? I think we all have periods where we feel a little blue and a little sad, and that's normal, because if you didn't have those, you wouldn't have the highs of, wow, everything is really great. So you need to have a bit of that emotional roller coaster, but you don't want it to be so severe that it becomes debilitating to you to get through your activities of life.
And on the other hand, I don't want to be medicated to the point where I feel like I'm just blah.
Absolutely.
Absolutely.
Because everybody has highs and lows.
Right.
Sure, and that's part of what makes life rich, right? So it's never our goal to make someone feel numb or feel like a zombie or things like that. That means you need to have this continuing dialogue with your doctor and adjust things so that you feel like your usual good you, and that you can experience all the richness of emotions, but not feel so stuck that you can't get out of bed, that you're crying all the time, that you don't want to be here anymore, or so frightened that you're paralyzed to walk out the door in the morning.
Very good. Patricia, can I ask real quick? She's got a good comment. She says, lately, my stomach hurts all the time, and I've also been going through a stressful time at school. Do you think stomach pain is being caused by anxiety? Maybe she should see, again, GBMC and Sheppard Pratt. I mean,
right, so that would be a great time. Come to see your primary care physician.
Correct.
And ask them about your stomach pain. And we know that stomach pain and chest pain are often associated with anxiety. So it can be a red flag for us to ask those questions about, are you having other issues? I mean, that's one of the first things, the go-to questions. What type of stress are you having in your life? Is anything bothering you? How are you dealing with things?
But it might be something medical in the primary part of your body as well, and that's why having a skilled physician that can help sort those things out for you is really helpful. And this is where the partnership between these institutions is so very valuable. We're very lucky that we have Sheppard Pratt, the largest not-for-profit mental health system in the country. 2.3 million visits last year. Like a huge system as our partner.
Yes.
GBMC, this excellent community psychiatry program, the Kolmac Clinic, which provides substance use services, motivational interviewing and linking folks to services, and then a subsidiary of Sheppard Pratt, which is Mosaic Community Services, all together as a team, so we can kind of be the Harry Potter sorting hat and help get folks to the right spot where they really get the care that's tailored to what they need.
I feel like it's the biggest problem that we've got in our society right now on so many levels. And Mindy, you've got a question that's coming in?
Yeah, well, actually, it was a comment by Jocelyn. She said she's one of the behavioral health consultants at GBMC, and she said the program is great. So it's great to hear the providers are feeling, that it's helping the patients as well. We also got a question, are health insurers properly covering the treatment for mental health and or substance abuse disorders? And can I have you move a little?
Yeah.
We can't see your face.
This microphone's hanging, sorry.
Yeah.
So historically, mental health has really been tremendously under-reimbursed, actually, as has primary care. So historically, health services that have procedures, cutting off a mole or doing a surgery, were reimbursed a lot more than procedures, the thinking professions. And this has led, and also for many years, people's health insurance covered their medical health care, but mental health was in a separate basket, and many people didn't have benefits. Recently, there are laws that require equity. So if you get medical insurance, it has to include your mental health because it's all part of it. And that protection has really let a lot of people say, boy, I've been struggling with this for years. Maybe it's time now to feel better. So we have a shortage of mental health providers. There was this nice study in 2015 by the Mental Health Association of Maryland, and they looked at more than 1,000 psychiatrists that were listed on the health exchange, and only 1 out of 7 had an appointment in the next 45 days. Okay, that's terrible. So people call and they can't find anyone. So this is one of the ways that we can stretch our valuable mental health resources, because a lot of people with kind of regular stuff, low-lying depression, low-lying anxiety, can get well cared for and get good quality care in primary care, and they don't have to try to access specialty mental health, and we can save that for folks who really have a higher need.
They say 60 to 70% of people actually who are being treated for depression and anxiety are actually treated in their primary care office. And there is a huge shortage, which is another reason why this program is so important, because when you come to see your medical doctor, your insurance does cover those services. When we hand you off to a licensed certified social worker for counseling, most of the time those services are covered. The psychiatry piece is the piece that's always been elusive over the last, 10, 20, 30 years, because of the discrepancy of the way that the psychiatrists are paid. So that's why this program is so great. When we have the psychiatrist in the primary care offices, we are able, as a primary care physician, to talk to the psychiatrist and maybe not even have the patient be seen. They have to be seen at least once. But once they're seen once, we can have these ongoing conversations about how primary care can manage the patients, and then that's covered by your insurance, as long as you have medical insurance. Your primary care managing your medications is something that is very usually covered, and it's been a great team effort from Sheppard Pratt and GBMC to put these services in place for patients.
Well, I would guess that a lot of the drug abuse issues and crime and a lot of the things that are going on in our society are rooted in psychology and psychological issues that are out there. And I guess the biggest challenge you probably have is just getting everyone treated. I mean, it's great for people watching who have health insurance, but if you don't have insurance and you're unemployed and you're a drug addict or you're an alcoholic, and there's someone watching, where do you go for help? What do you do if you feel like you have no one to help?
Right.
Well, there are some phone numbers that people can call.
Absolutely. So there's always a crisis line. So 1-800-273-TALK is the National Suicide Prevention Hotline.
What's that number? You can give it to me.
1-800. 273
TALK. Okay.
Also, Sheppard Pratt has a Monday through Friday crisis walk-in service that is tremendously valuable, that you can go in as an alternative to the emergency room and get a rapid assessment. They're not going to prescribe medicine, but they can help you hook you to the right folks that will be able to treat you. So that's very helpful. If people are really in crisis, every county has a crisis response unit. It's available on the county website. And you can always either go to your ER or call 911. There are also many people who are eligible for benefits. either through the Affordable Care Act or through medical assistance that they don't know about. So we can also help you connect, and you probably have the ability to get health insurance, especially if you have low income.
And that's where the primary care offices come in. We have care coordinators who can help to connect you with those services. So if you don't know, you don't think you can afford, first of all, you can come in to see your primary care physician, and we do have a reduced payment for people who don't have insurance. And then we also have a group of people in the offices that can help to connect you with some available resources or look into that to let you know what might be available for you.
Great. We've got a few other questions. I don't know if we're running out of time. Let me give one more then real quick. How common is it at the end of a day you come home and you're like, I'm going to have a glass of wine? And maybe it turns into 2 glasses. Someone's asked, I drink a glass of wine every night before bed because it helps me relax. Is that a problem?
So 1 glass of wine, no. 5 glasses of wine, yes. So it really depends on how much you're drinking. And a lot of times people will pour a glass of wine and they think it's 1 glass, but maybe it's really 2.
Yeah, or half a bottle.
Yeah.
Right.
So generally what we say, if you're drinking for a woman more than 4 drinks a day, that's a little too much. And if you're a man, 5 drinks a day is a little too much.
And over the course of the week, the goal is, I think, less than 7 for women and less than 14 for men.
And a drink is, I mean, I've seen specials before where you actually, measured. It's how many ounces, right?
I think alcohol, hard alcohol is 4 ounces.
4 ounces?
And wine is 6.
6, okay. Well, we have so many more questions, but I guess we're running out of time, Mindy.
We are.
All right, do I have time to give away tickets real quick?
We do.
All right, so all the questions that have come in
Shake them up.
are in here. We're going to shake them up. I'm going to have the doctors here pull out winners. Now, this is for meet and greets or for Sunday in the Country?
We're going to pick 4 names for tickets to
Okay.
Sunday in the Country, and then we'll draw the meet and greets out.
Got it. 4 names for tickets.
So they can each pick 2.
Okay.
Okay.
Each of you take 2, please.
All right.
And then you can call out the winning names. We'll find out who's going to join us on the 24th at WPOC Sunday in the Country.
This
with
is so
Rascal
exciting.
Okay, I have Catherine Fletcher and Shelley S.
Congratulations to Catherine and Shelley.
I have Stephanie Ball and Judy Parks.
Woo! So they're all going to WPOC Sunday in the Country.
And we're going to draw from those 4
Oh, from
and
those
these
4.
2.
Oh, those 2. Okay.
All together. We're going to dump that bowl out.
Okay. Put them back in here. And this is for a pair of meet and greets.
Very exciting.
You got to go backstage.
So just one name.
And
Just
hang
one
out
name.
with the stars.
The lucky person.
Quite a few country stars, too. Again, you'll get them all at WPOC.com. Would one of you like to pick?
How many do we have?
We just
One.
need 1.
Just one, just one.
And the grand prize VIP winner is...
Stephanie Ball, you're welcome!
All right, so there we go. Can we wrap up with a question, if it's okay? I've had a lot of these questions coming in. This is very typical. I'm a new mom, and lately I'm feeling frustrated and exhausted, as any new mom would be. I have 4 kids, and so I know what it'd be like to be a new dad, but on top of the delivery and the physical portion of it for a woman is obviously different. She says, I can barely get out of bed. I'm not sure if this is just how all new moms feel, or if it may be something more serious. Should I talk to someone?
Absolutely. That sounds like that is a great conversation to have with your primary care physician. So that could be a problem.
Yeah, or your obstetrician should be familiar in helping you do this. And there are some great websites like Postpartum Support International or Healthy New Moms, which is out of Maryland, that can give guidance because you may be developing a postpartum depression. And it's important to get a handle on it quickly because you want to take care of yourself so that you can be there to take care of your baby. And other things that family members can do is make sure that they're feeding you and that they're giving you time to sleep because you're just so exhausted.
And they're giving you time off.
Yeah,
for yourself.
but if that's not enough and you just are feeling lousy about yourself, or if you're having any frightening thoughts that you don't want to be here, you wish the baby wasn't here, thoughts about hurting yourself or hurting someone else, then that's an emergency and you need to come in and talk to us right away.
This is serious stuff, and it's evidenced by page after page after page of questions. We don't have time to get to them all, but for someone who does have a question, again, point them in the direction. Should they call the 800-273-TALK? Should they talk to their primary care physician at GBMC? What do you advise?
So I think it depends on how serious you think your issue is. If you have a question about it, is this really serious? call your primary care physician and they can help to guide you. If you're feeling a little bit of maybe I feel anxious, maybe I feel depressed, maybe I have an issue, definitely make an appointment with your primary care physician and ask them. GBMC primary care physicians are listed on mygbmc.org. You can go find a doctor and we can plug you into one of our 10 primary care practices around the GBMC region.
Also on both the Sheppard Pratt and the GBMC website, I think there's a link to this program, and we'll be able to answer questions through the moderator over the next period of time and get back to folks with general guidance, very specific things to you. We can't give you medical advice online, but we can help steer you generally in the right direction.
Great. Well, GBMC, Dr. Robin Motter-Mast, and Sheppard Pratt, Dr. Catherine Harrison-Restelli. It's been great talking with you ladies. Any other questions from the producers there, Mindy? We're good? Well, that's it. So thanks for watching. Share this with your friends and people that you think would benefit from the information that was discussed today. And if you've got questions you're thinking about, why not ask? I mean, that's the biggest hang up I think that we all have about anything that's psychologically based. We're afraid because you might think less of me. Ask. If you're concerned enough about it that it's bothering you and it's top of mind, ask somebody. What's the worst thing that can happen? They can say, I think you're going to be fine. Maybe you get some help and it can change your life and make your life a lot more livable. So that's it from iHeartRadio here today. We're going to be doing another GBMC in the Facebook Live in the future. I don't know when.
October 24th.
October 24th. They'll have me back. I'd love to be a part of it again. Thanks for watching. Thanks for listening. And thanks for keeping in touch.